Thanks, Anil. Good morning, ladies and gentlemen, and welcome to this conference seminar on enabling healthcare entrepreneurship. It's great to see all of you here this morning, fairly early, and the hall is almost full, so it looks good. In a way, it's a reflection of changing times. When some of us began looking at healthcare 10, 15 years ago, if you had a session like this, typically it was full of pharmaceutical companies. You had people, discussion topics around para for challenges, you talk about ANDAs, and healthcare services was represented by a lone company here or there from India or Southeast Asia. I think it's a reflection that today this group here represents a very broad cross-section. There are dozens of small companies which are navigating their way, trying to grow into the healthcare sector. We have healthcare operators, we have healthcare investors, we have enablers, and we have a lot of you who are looking to see where they can find the next opportunity in healthcare. So we are hoping that over the next 3 or 4 hours, we'll be able to demonstrate to you where the opportunities could be and what you could do. The interesting thing, though, is that on the surface, if you look at it, healthcare seems to have improved. If you look around, you see more infrastructure, you see more hospitals, you hear of more names. So it looks like things may actually have got better and healthcare actually has improved. The reality, though, is that if you read the recently released McKinsey report, the unfortunate thing is that despite the progress made in the last 10 years, healthcare indicators continue to lag behind for India. Whether it's a life expectancy, whether it's a non-communicable disease, we are still lagging behind. Actually, further behind than we were 10 years ago. Healthcare spending has not grown at the same rate as GDP has. So despite all this talk about healthcare having grown, we continue to lag behind. Healthcare out-of-pocket spending actually, despite insurance companies being here, has actually gone up. So despite the fact that we've had almost 10 years of health insurance coming in, healthcare spending actually, out-of-pocket spending is up. And huge infrastructure gaps exist. We all know that. By whichever measure you measure it, number of beds or whatever, the reality is that healthcare infrastructure has fallen behind. And finally, as we grow this healthcare sector, the number of trained people, whether it is doctors, whether it is paramedics, whether it is nurses, whether it is technicians, is not keeping pace with the kind of growth that the healthcare sector is seeing and needs. So I guess the typical answer has been throw more money. The US spends 18% of GDP on healthcare, and the biggest debatable and the most discussed topic is the deliverability of healthcare. India spends 4%, we still have the same discussion. So it ends up in each country having to evolve its own system, its own ecosystem, its own way of coping or finding out how healthcare spending has to be done. And it is true that while government and the large infrastructure will lead the spending, I think far too much attention has gone towards large infrastructure spending, large hospital build-up, and not enough to the people who will provide the picks and the shovels and the tools to make that healthcare happen. It is going to be the services companies, it's going to be the consumable manufacturers, the device manufacturers, the enablers, the payers who are going to actually make the system a better system and a more effective delivery system. And I think that's where the opportunity lies. And to do that today, we have in our first panel, as you will listen to our panel here, on healthcare entrepreneurship, where the opportunities are and where we could be heading. We'll lead that on further in the day with other discussion panels that you will have on frugal innovation. We'll showcase a few companies that will show you how and the challenges that the younger companies are facing in what they're doing. And finally, we will talk more about the role of incubators and things. The panel today, on my extreme left, is Gaurav Malik. Gaurav is a well-experienced M&A specialist, a private equity investor. He's a partner with Olympus Capital, and he recently made a huge investment in one of the larger healthcare infrastructure providers in the country, and he'll talk more about that later in the day. Next to him is Ajay Vij. Ajay is the CEO of Asian Healthcare Fund. He built the Dabur Oncology business for several years before exiting from that business, and now does investment in healthcare. He's on the board of Famicare, Devanchand Agrawal, which are some of his investments. We have next to him Amit Mokim. He leads the KPMG healthcare vertical, and he has been advising governments, large infrastructure players, device manufacturers, and all the other sub-segments in the healthcare area. And he also is involved in KPMG strategy, M&A, and private equity practice. Last but not the least, my friend Dr. Vikram Chetwal. Very unique combination of a medical doctor who has a business degree, understands both medicine and business. He was sort of the founding team member at Apollo Health Street, and after that was the CEO of Reliance Hospital Healthcare and set up the Kokilaben Hospital in Mumbai. He's flown in from Mumbai for this event, and please give a lot of applause to our panelists, and then we'll start the discussion. I'm going to start by asking Amit to spend a few minutes and talk about the macro picture before we get into the actual discussion. So Amit, over to you, please.
Good morning. Good morning. Thank you. So this topic can go on for a whole day. And before I start, I'm going to make two promises. I'm going to leave $20 billion of opportunity for you on the table before I get off this panel. And this is the only slide which I have where I'll talk about beds. The rest is all about not beds. Can we beam this up? Is there a way to beam this up?
Yeah.
Oh, got it. Thanks. Yeah. So, on the good note, I think we all talked about insurance and everything, but we believe that over the next 5 years, we'll have at least 50% of our population covered in some way or the other by insurance. And that's going to change the way healthcare is going to be delivered, managed, and priced in the country. While we all talk about bed shortage, I think we've added more than 500,000 beds in the last 10 years. I think we need to slow down on adding beds and think about other models. More than 10,000 crores has come in over the last 3 years, just in terms of private capital to support you guys to build out your own businesses. And there's lots more. We've got Gaurav, and I'm sure he'll endorse this along with Ajay. But in my field, healthcare is one of the topics every large, medium, and emerging private equity and venture fund talks about. It's on their agenda. We have the largest telemedicine network in the world. Being in KPMG, I've had the opportunity and privilege to actually work across many parts of the world and also be parts of different think tanks, thought groups. Everybody is watching India. Everybody is looking to us on frugal innovation. And everybody is seeing how we are building out different models because they've already built them out. They want to see what we do on not making the same mistakes some of them did. And lastly, I think what's good here, and congratulations to all of you, you are the guys who are building the system out from bottom up. So we talked about this. I think there's a lot of money out there. Obviously, it's becoming more and more interesting in the way people are evaluating the funding. It's beyond the usual euphoria where somebody was saying biotech or somebody was saying health and people would come and fund you. But actually, there are a lot more business models. And as KPMG, actually, we profiled 50 business opportunities that will come into India in health. I'm going to talk about 4 or 5 of them. Would love to have a word with any of you after this session, later on what our thoughts are. And we're going to publish down the year a report on it as well, which will be for everyone to go through. But really, this is the situation. we are going to have 58 million deaths in low and middle income countries, and we are one of them. And more than 40% of them are going to be because of chronic conditions and non-communicable diseases. We're not ready for it yet. If you look at the other 3 countries, and it has South Korea, Brazil, and Thailand, we were at the same place in 1960 in terms of very basic metrics: insurance coverage, doctor density, share of private beds. And we're still here. The rest have moved on, and you see the 2 arrows? This is where we've moved to. So there's a lot of upside that still remains. The other thing, and while we talk about all of this, 50 to 70% of the non-communicable disease burden will sit in rural India. So we do need models to actually map that market. But at the same time, I also believe that some of these models will come from urban India and adapt them to rural India. I don't think it's always a bottom-up rural India only story. Think about models that fit in urban India, make them industrialized, and then get them to rural India. That's how they'll be effective and sustainable. Where is the opportunity? And I think many of you all are sitting here. Family medicine in clinics. I have someone who I've been working with from NHS UK who's building out a family medicine business, and you must catch up with her at some point on her experience. Home care, which sits on a huge basis on family medicine. Clinical screening testing, huge unorganized growing market, and I can say this because we are working with very large global players who want to come into India and set up businesses, especially on clinical screening and testing. Dialysis, and I'll show you the numbers, you realize what's happening out there. Tech-enabled patient engagement, very, very interesting, and because we'll always have a shortage of resources, we really have to think about what do we do here. Low-cost medical technology, health education, and healthcare in tier 2 cities. The list goes on, but I'll just talk about a few of them. Primary health delivery, to our minds, is a 35,000 crore annual opportunity. Urban is a huge component of that, hugely untapped. Today we have 80 to 90 operational centers amongst 7 to 8 players. If you see other parts of the world, and many times we are faced with the debate, is primary care a public initiative, is it a private initiative, what should government do? And being part of a think tank on primary care globally, most of the successful primary systems across the world are built by private practices. What the government does is engage with them. And this is an opportunity which is scalable. You can start in a certain metric. There are various ways of looking at it, obviously given the Indian dimension. People have had challenges. It's not that everybody's been successful, but this is an opportunity to watch out for. Hemodialysis, $2 billion. Current market is only $100 million. Huge shortage. There would be about 800,000 dialysis centers, so many nephrologists. We got to think about what do we do for the rest of this huge circle that does not get dialysis. Technology, and this is food for thought, but really look at every technology in a way where how much you want to interact as a provider and where is the innovation. And as you see, a lot of this in healthcare delivery can actually move to digital. And we've done some cutting edge research on this particular bit, but globally there are models that are coming up in a lot of physician engagement, mobile technology, telehealth, physician networks, remote monitoring, online pharmacies. All this can actually move out of hard infrastructure. While your physical examination, procedures, all will continue to remain physical. Diabetes, and I have a friend here who's actually trying to build out a diabetes business. Again, huge untapped opportunity. You all know the numbers, 60, 65 million diabetics, few thousand diabetologists. We're not going to get treated by those diabetologists only. We got to think about a model where a lot more self-care, a lot more enablement of the current GP, doctor, nurse network has to happen to take care of diabetic, chronic, long-term conditions or life conditions. And it's not just about devices. It's also about how you deliver care and how you engage the patient. Emergency response, and Vivek was mentioning it, it's a $1 billion opportunity. We have about 12,000 ambulances that will come up. It's both government and private. We have a few players, we have a few cities where we have some kind of ambulance coverage, but there's a huge upside potential here on how you kit those ambulances and what services you provide on top of these ambulances. Health education, and this is huge. I think It's again a $500 million opportunity clearly sitting out there. The government is thinking about it, what to do, both at the nursing, allied health, paramedic, all these different categories. But I sincerely feel that the private players will have to step up to it and build out businesses to actually support the ongoing challenges people are finding in managing attrition in hospitals, training, and even patient care delivery. Telemedicine, huge opportunity, lots of pilots going on, but to our minds, it will sit on public programs as well as how your infrastructure builds out to enable or support telemedicine. So be cautious about this opportunity. There's a huge opportunity sitting out here. Medical devices, we talked about it, 70% imports, 30% with Indians. Most of the medtech coverage, and we work with many large global medtech players, tier 1, somewhat tier 2 cities. Huge opportunity left behind because that's where the build out is taking place. So what's out there for you? I think if I total up the numbers, we come to about 18 or 19 billion, grossly underserved. That's the interesting part. You need disruptive models. You clearly need disruptive models that address the 3 dimensions on the way you look at healthcare: cost, quality, and access. There's a true need from the patient, and he's going to be your customer from now on, and the world is watching what we do. So good luck to all of you, and I'm happy to share whatever we've done if it helps any one of you all as you all think through your businesses. Thank you.
So, thanks, Amit. Gaurav, you've heard about the opportunity, and you just made a large investment in healthcare. Tell us what is so attractive about healthcare? Why is there seemingly a rush of people who want to put money into healthcare?
So let me actually start with a story. One of our CEOs of our healthcare investing company, he's very religious, and I ask him that every time you go to pray, what do you pray? Like, people should fall sick, there should be accidents, because that's what drives your business. He said, no, I don't pray for that. What I pray for is that people should be well. But if they fall sick, or if they have a problem, then they should come to our system. So they want to get and I think that's the opportunity in India, that there is, you look at any statistic on chronic diseases, on lifestyle diseases, or other, you look at the environment, the amount of asthma that you're seeing just because of the quality of air. The demand is just huge. And there are different pockets. I think, you can't look at it just as one big market. I think the urban market is different. The semi-urban, the tier 2 cities is different. The rural market is different. So clearly, I think everybody sees this, macro demand supply gap. I think the biggest, at least from our perspective, I think the biggest, challenge or issue we've seen is that, in India, unfortunately, due to our obsession with the real estate, the cost of any kind of, systems or hospitals or even, primary care has just gone up so much because it's so expensive to set it up. And as a result, what you've seen is that people have gone for models which are targeted at the upper middle class, the rich or the upper class. But I think the mass market is still pretty much unaddressed. I think people are still relying on the public healthcare system. And I think to Amit's point, I think that how do you provide quality and access at the right cost to the mass market? I think that's still a big opportunity. I think that's still unaddressed. I think that comes back to this what kind of things are interesting, what kind of opportunities. I think it's this capital light, real estate light, disruptive models where you don't need to go to a hospital for every single thing. For example, dialysis, renal care has been a huge market for investors and entrepreneurs across the world. It's one of the areas where I think in the US there have been literally hundreds of deals which have been done and investors have made money. In India, the dialysis market is still pretty nascent, pretty non-existent. People are still relying on large healthcare, large hospitals, and that should not be the case. I think it's very specialized. It could easily be done in a much smaller, much more, in a much cheaper and much better environment.
So I guess clearly demographics is one, the supply-demand gap is the other. How much of this, Vikram, you've sort of been in a hospital yourself, you run it yourself. How much of this is just driven by the ability to price services almost at will, because people have to pay because of shortage of services? How much of it is driven by the fact that you can take advantage of a certain shortage that is right now there? So is it just that it is medium-term opportunity where you can price at will and therefore hope to gain extra or sort of profits?
Great, thank you. So I agree. I think the market's actually been opportunistic in the way people have gone ahead and tried to build a P&L in healthcare. I'm going to take a step back, and Amit talks about cost, quality, and access, and that's what he said to you in his last part. He said, that's the tripod that we're all working on. And I think the first wave of investing in healthcare from a private perspective has been in creating geographic access. So people have actually gone there and built physical infrastructure. A lot of us like brick and mortar. Good Indian businesses must have brick and mortar. And we've done that very efficiently. I think where we've missed the boat, at least from my perspective, is that we haven't actually spent enough time engaging with the payer systems, the reimbursement of healthcare. And actually, I think that's the biggest stumbling block that is not allowing healthcare to go out there and get to the larger masses that you and I think is part of an opportunity. I don't think it's technology. I think there's adequate disruptive tools that are available today that would allow you to get to your point of care, irrespective of the geography it sits in. I think the big issue is we just have not engaged with systems that allow us to understand how we reimburse ourselves for care that we actually provide. Personally, that's a much bigger challenge than actually going out there and saying, let's build a dialysis business. Dialysis is a lovely opportunity. Tell me how you'd get reimbursed in it. And how many of us have actually sat down and understood how you'd engage with a reimbursement system that pays you $850 a pop? Have you actually gone back and said, how am I going to actually build? And so I think the basis of a lot of what we're trying to see and face in our market is because we haven't actually sat there and solved for financial access. We haven't looked at payer systems and how we're going to engage with payer systems when payers are sitting out there and saying, I'd like it to be performance-based, I'd like it to be risk-based. And in a market where, we've always been cash or fee-for-service, we've always been a cash economy. Hospitals have had a great time because we've been a cash economy and we like cash patients. The world is looking at this market because they, whenever you put up a slide and a private equity investor comes up and you look up there and say, you know what, 80% of our money comes in cash. Everybody loves that and say, I hope this is never going to change. Guess what? It is going to change. And the minute you change that paradigm, we don't know how to survive. We really don't know how to operate as a business. And innovation is we talk about tech innovation and tech-led innovation. We really haven't talked about money-led innovation or financial innovation in terms of how you engage with your payer system. So maybe, that's a conversation that is at least needed in part to solve for what we're talking about.
Yeah, so I guess, there obviously a lot of activity has gone or action has gone into the enablers behind this. There has been some progress on the insurance front. I mean, at some time do you think there is going to be a government-led Narega type or Aadhaar-based system for putting money directly into the hands of patients, and could that be a big game changer for this country?
Is that a question back to me?
Yeah.
Oh, DCT, direct cash transfers, has been a big thing in the papers 5-6 weeks ago. But let's park that for a minute. Is there going to be a system that's out there? Yes, I think there's enough between the Rashtriya Swasthya Bima Yojana and state schemes, and every state has today decided and learned that if they don't actually bet on providing care, access to care, at least for catastrophic illnesses in the market, they're actually, it's an important re-election agenda. You're not going to win if you don't actually build systems that allow you to do that. Ask all of the private players and tell me how many of us have actually figured out how to engage with RSBY. We're all still very iffy about, nahi karna. CGHS, not sure whether I want to play in that market. And that's a big problem, right? Because they're beginning to account for a large part of the footfalls that you and I are going to see in the markets going forward. Today, RSBY spends over 20,000 crores. When you actually look at it, that's $4 billion. So, you can park all the other opportunities and say, in the catastrophic world, I have $4 billion of payout. I just haven't figured out how I'm going to engage with that payout.
So good, that's one opportunity.
On this UID, I think we have all the rural infrastructure there. But what we need to figure out is how they are being implementation is happening in terms of screening, prevention, and all that, and the tracking. I think that's where maybe I feel UID could play a role, where you could track it back to are the vaccines reaching the end population? Is the screening happening on time? Is the communication happening on time? Because you've got those people there, you've got that infrastructure.
Ajay, moving on, you've been involved with a successful pharmaceutical business, and it looked like in the 90s that you could build a successful pharma business. It was still a reasonable scale situation. It looks like today that that's getting more and more difficult to do. How do you see entrepreneurship in the pharma space? And as you look at opportunities, where are you seeing the new opportunities in the mid and small segment space?
In pharma, the situation with pharma is that generic pharma, which is what India has been famous for, which is where a lot of money and value has been created in the past, is actually becoming almost a no-win game. Why? Because on one side, in that business, you have a situation where the input costs are going up year on year, and the selling prices of the products are going down year on year. To maintain that balance, you need scale. To get scale, you have to move beyond Indian shores to operate in the bigger markets of Europe, US, and the other emerging markets. And to do all of that, you need very deep pockets. And that's why you see the generic pharma world consolidating and acquisitions happening, so on and so forth. So, to play the same old game of building what Amit called brick and mortar pharma company, I think that those days are over from a value creation standpoint. So personally, I don't see a great opportunity in that play. Where the opportunity still exists is where smaller companies are engaging in innovative drug delivery systems, for example, which are unique, which will provide a cost advantage, and with those innovations, they'll be able to align with the bigger pharma companies and sell, quote unquote, their product or service. So that is an opportunity area that one could look at from an investor's eyes. As far as the other opportunities are concerned, in healthcare, I think my favorite one on this is that this is one area where demand, whichever way you look at it, is not in question. So the classic Kotler textbook thing that look for, need, gap. Here you don't have to look for it, it stares in your face. The issue is that with all the opportunities that are out there, there are some serious challenges that we are faced with. And we have to pick and choose opportunities to make sure that the businesses are able to meet those challenges and be able to create value. So I'll take a couple of minutes to explain what I'm saying. Most healthcare businesses that we see don't have positive cash flows for years on end. 4 or 5 years is almost a given in any build-up that you're looking for. We talked of primary care clinics. We have seen several businesses in the area. We are considering investment in one of those businesses. No positive cash flow. Center level, the business breaks even, but at the corporate level, after the corporate costs, 5 years, there's nothing positive in the bottom line. So the entrepreneur and the investor has to have very long-term horizon. And that very long-term horizon is not 4 or 5 years. It has to be more than that. So there are opportunities. So primary care, we see opportunities arriving in single specialty businesses which are meeting the need of low capex and low opex situation to meet with the interim needs of the capital requirement for the business. So that's a great opportunity area. And I think moving beyond the urban healthcare requirements into the tier 2 towns, addressing the population which is not poor, but are the tier 3 town people who have more affordability than in the past, to bring services to them at a much more cost-effective model. So all of this is easily said than achieved. And we believe that the combine of the entrepreneurs, the service providers, the equipment manufacturers, very importantly, the equipment manufacturers who count for a large share of the huge capex that go into any business, have to come up with innovative models. We talked of CT/MRI, we are in one of those businesses. If you look at the data which comes out of the McKinsey report, CT population in India is 0.9 per thousand compared to some 18 odd globally. MRI population is some 1.8 compared to some figure of 32 or something globally, if I don't have the data messed up. But it's that wide variety of difference. But guess what? Most businesses in CT/MRI are underwater. So innovative supply end for equipment arrangements for the entrepreneurs is the need of the day. And I think somebody will have to get that fixed right, and the opportunity will be there.
So one of the things that strikes me, and Gaurav, maybe you can help answer this, one doesn't see much by way of Indian companies in large medical devices, medical consumables. I mean, here is a whole industry that has grown several fold in the last 10 years. It hasn't spawned many startups or many mid-sized companies that either devices or consumables, or for that matter, as you're talking about pharmaceuticals and things like contract research or things like that. You haven't really seen much of that happening. What do you think is happening there?
Actually, before I come to that, just one other comment on this. I mean, I think all of us see the healthcare opportunity, and maybe just I'm talking about delivery. I think all of us see the opportunity, the demand, and the limited supply. But on the other side, actually, if you look at the companies and the performance of the industry, it's actually not that great. I mean, if you look at our pharmaceutical industry, we have, I don't know what the number is, but we have like 50 plus listed companies, market cap of over $50 billion or some number like that. And some of that is addressing global, some of that is addressing India, but still it's a fairly scaled industry. If you look at healthcare delivery, hospitals, clinics, diagnostic centers and things like that, we have 2 listed companies, combined market cap of, less than $5 billion or something like that. And as you start going down, you see that, while you see the opportunity, you see these hospitals which are, very well put together, running very well. But when you start actually looking at the numbers, they're actually not making that much money, or the payback periods are so long that, as a pure financial investor, it's just unviable for you. And I think that again goes back to that you need to get the right model. And I don't think we have the right model. I think in terms of, if you want to set up a hospital in, say, in a big city, and you're going to pay 400 crores, 500 crores just to get the land, how you're going to price it, who you're going to target it, and how you will recover the money. I think that's a big question. So at least, we invested recently into a healthcare delivery company, and at least the way they're trying to address this is they are going to tier 2 cities, which is what Ajay was talking about, going to cities with, places like they have a hospital in Kolhapur, which is a very prosperous city, about 1 million people. So in a global context, it's actually not a tier 2 city. It's a reasonably large city. And there's enough capacity to pay in a city like that, where people traditionally have gone to larger cities to get treatment. So you can probably think of a viable model where you go into these smaller cities, set up slightly smaller hospitals, and see that they are viable. Because I think the one thing we really struggle with on some of these things is that while we see the opportunity, the macro opportunity, if you look at the performance of the sector and the companies, it's actually very mixed. I think coming back to your medical devices question, I think we haven't looked at that space very closely. But what we've seen from our hospitals is that when we are trying to buy medical devices, the kind of things that are available both from domestic, international providers, second-hand equipment which is available, equipment which you get almost for free, and you're basically paying because they want to just have you buy the consumables. I think in some ways, maybe just the over-competition on that side has just killed the entrepreneurship. I think it's just, at least just from outside, it seems like it's not easy to get into that industry. have the ability to support R&D, develop something and then be able to, monetize it.
Ajay, on the last question on the pharma side, why contract research seems like a good opportunity for a country which sort of has already demonstrated success in IT services, and in a lot of ways, why have you not seen much happening by way of contract research, etc., in this country?
Because one of the problems is that you're always at the mercy of your customer and not quite the end customer. So you may be tied up with a pharma company which has a program running on the contract research, and suddenly they decide because of some XYZ slowdown or some problem with their own system, and we know global pharma companies are struggling in certain areas. They shut down the program, and then you suddenly...
But that's the same with IT companies. I mean, we've made a success of IT companies, so it's not that different.
The investment required versus the IT setup is widely different. Even if you have to do a contract research, you need almost, though on a smaller scale, similar level of facilities that you require for a big pharma company. So you need to have proper GLPs, FDA approved facilities, and so on and so forth.
Okay, so before we wrap this panel up, we've talked about a lot of things, but I'm going to ask each of the panelists to, and you'll have to think about this, to pick up what you think are the top 3 opportunities that you think should be available, not for the large infrastructure players, not for the people who want to put the 500 crores, but for people who are looking to build small businesses in healthcare. So each of you, if you can think of 3 places. Vikram, you go first.
I got caught out on this one. I don't know if I have 3. No, I guess the biggest opportunity for me is along the theme that I spoke to all of you about, which is that actually there needs to be at least a conversation around who are the enablers for easier payer solutions or payer innovation. And I think that an opportunity to actually look at intermediaries who work in the payer system or who at least enable that financial access into healthcare is opportunity number 1. Opportunity number 2, there is a whole slew of activities or activity that we're seeing in focused factories in healthcare. People are actually going and doing ophthalmology, people are going out and talking about dialysis, people are talking about focused factories, and I really see them not from an opportunity purely from just doing the same thing over and over again, which is good, but I also think that it really does impact the cost paradigm. In how well would you be able to reach out into the masses or into the markets that you wish to operate in. So that would be the second space that I think would be very interesting. The third space that we've actually missed out here is the technology that enables all of this. So whether it be medtech or HIT, healthcare information technology, there's not enough work that's actually keeping up with what all of us are trying to do in building physical infrastructure, in actually building technologies that allow us to match our infrastructure to a payer system or any other environment in terms of creating synergies between various constituents in the market. So those are my 3 picks.
So I think from my standpoint, one really is, and I talked about it, the whole delivery model at the bottom end of the chain, which is either family medicine, specialty, chronic care management on the urban side. And I think the flip of that is the healthcare infrastructure build out, and even beyond just family medicine or consultation, but even secondary care or tertiary care in tier 2 and tier 3 cities, because it's completely untapped. I think the second point is around education. I think that's a huge opportunity, especially for entrepreneurs. And the third part, I think Dr. Chitwal talked about it, but really technology that enables delivery, or it enables better access, or it enables better analysis, or to link up or make the interaction between payers, providers, and government more efficient. I think that to my mind would be the third.
So first, on the lighter side, the opportunity for an entrepreneur here is to ensure that the area where there is such a huge shortage of skilled manpower, that is the doctors in the country. Don't become businessmen like our friend on the panel. And stick to the core specialty. And actually that's a great opportunity area which Amit mentioned, and I completely agree with him. Healthcare education is a huge, huge opportunity because there is such a shortage of particularly the specialists in the area. What we see from a practical real standpoint are the following opportunity areas. One is the secondary care in the tier 2 towns. Abysmal level of care available today, so models which will address the demand requirement there would succeed fabulously in our opinion, and we see emerging players in that segment. Single specialty areas, we've seen ophthalmology, we've seen dialysis centers coming up. I think urology, nephrology and stuff like that, along with eye care, dental care and so on, are again a huge, huge opportunity area. And finally, the primary care segment, where the re-emergence or coming back of the quote-unquote the GPs, the friendly family doctor or clinic that you can go to, who will be your real friend in need, and we all have that need, even living in big towns like Delhi, not to talk about the tier 2 towns. Those are the opportunity areas which we should.
So I think I'll actually start by saying what not to do. I think often people get carried away by theme of the month or theme of the year or flavor of the year, and so I don't think people should look at things where it's easy to raise money. And we've often seen that again, I think it's everywhere in the world, but I think it seems a little bit more in India. When you see somebody build a successful eye care business or a successful diagnostic business, there's just a lot of people running in to do the same thing. I'd say, I think just sort of focus on what your core is or what you're good at. But I would say 3 themes in my mind. I think one is, and I touched upon this earlier also, not to harp on it again, but I think capital light. I think, sort of thinking smart and being able to do things where real estate is not a big part of it. I think second is sort of specialized care, and I think everyone on the panel touched upon this, non-hospital care, ophthalmology, we've already seen success. Diagnostics, we've seen a fair amount of success. I think dialysis, people are coming up. Things like that. And I think the other opportunities, I think, again, focusing on tier 2, tier 3 cities, where again, it should not be equated. Tier 2, tier 3 doesn't mean poor. I think it's a different scale, but there is actually a lot of ability to pay in those markets. So providing access, providing care, in those cities versus people from those cities coming to bigger cities for secondary and tertiary care.
So I guess I can have the last word. I think, to my mind, I think it's a great time to build businesses. It's probably a better time to be building a business than to be investing into healthcare at this time. I mean, if you look at the valuations and the whole paradigm, I think those who started building these businesses 10 years ago are reaping the benefits of that today. So I guess if some of us here are going to be here for the next 10, 20 years, it's a great time to go build those businesses. There is a need in virtually everything. You've heard from the panel. To my mind, I think one of the biggest opportunities is just providing the picks and the shovels to the existing operators. Everybody today is doing everything themselves. All hospital operators, from the laundry to the kitchen, to the housekeeping, to the security, everything is being done themselves. I think, and I'm talking only about the peripherals, you can go there because you can take the same route along the clinical path, etc. I think a lot of players who can specialize in individual segments can start providing opportunities or start providing services across these hospital players. I think that can be a big opportunity. It's asset light, it relies on expertise, and doesn't necessarily require a lot of capital to put together. I think certainly education is going to be the biggest opportunity because there's a tremendous shortfall. For those of you who may have read the recent report released by the Public Health Foundation, I mean, the gap is just mind-boggling. There's nothing like that exists. There's no gap like that exists anywhere. And if all this money that you talked about earlier has to flow into healthcare, it has to only be done through the channel of these people. The third, I think, would be, and it requires a little bit of thinking, but could be thinking out of the box and looking at how we can leverage on existing infrastructure. I mean, the public health system has a huge infrastructure. The PPP model has sort of been done in bits and pieces, But if some of us can start influencing policy and try to get that done, I think there's a huge opportunity to get asset-light, use expertise, and get better bang for the buck, as it were, to be able to go forward. So I think, in my mind, those could be among the range of opportunities we talked about. Anil, the timekeeper, Anil, do we have time for questions? Or do we
take 3 questions.
Okay. So, okay, if you could identify yourself, ask your question, and refer to who in the panel you would like to ask a question. Gentlemen here, please. Okay. Go ahead, please.
I'm Niti Paul, and I'm a GP from the UK. I'm Chair and MD of Pathfinder Health India. I have the battle scars over the last 3 years trying to develop primary health care. And this is the question to your eminent doctor in the corner. I think you were spot on when you talked about the payer systems. It's the push and pull. Primary health care is the need of the day today. Your health indicators all over the world show if you don't have a primary health care system that works, your health indicators never change. And we know that from the US. Look at the Commonwealth Fund report, it says exactly the same. However, my battle scars tell me that the payer system has to be right. And if here, sitting in this room, all of us together, the investors and everybody, doesn't get that payer system right and talk to government, which we've been doing for some time, as well as talking to insurers and to the punters on a kind of a subscription model, this system isn't going to work. And we'll be stuck in the American...
I'm working on diabetes complication management software, which is based on CDSS, which is what is being is going to get implemented quite actively in US. Now, this is one of the, if these features were going to be connected to the insurance companies who were wanting to pay little less if there was prevent and control mechanism. So do you think that insurance companies are looking at this subject to say that how do they do the health assessment of the people, which is, let's say, the risk stratification, and then they are able to adjust their premiums accordingly?
Yes, I think so. I think the world is moving in that direction. They just haven't found enough partners in your market to be able to engage with that could give them a pan-India footprint. So that, most people don't start by saying, let's do a city-centric product. Most people end up, expanding the scope. So yes, I think that there is clearly a fiscal incentive to allow for programs like what you've talked about, which will ensure the hospitalization rates going down. But I think there is still a leap of faith on both sides that needs to be made before you would actually see these products. The first product, I think, was ICICI Pru that came up with a diabetes product, which is about 3.5 years ago. And they must have sold about 500,000 policies. But it was interesting. It was interesting because for the first time, you had people buy a plan that covered for diabetes. And so there was no adverse selection if you were a diabetic, okay? Which is interesting. And I think that this is only the beginning to a template that will evolve.
The question there, please.
Hi, I'm Shwetank Verma. I'm a healthcare entrepreneur. The question is for Ajay and Amit. Both of you touched upon primary care as sort of a core opportunity area. Yet, Ajay, you also mentioned that primary care models have 5 years of negative cash flow. So how do you get investable models, and why do you think no investment is really taking place so far?
First of all, there are investments that have taken place. Some bigger players, Norwest has invested in nationwide business, and there are more businesses coming up. The challenge, and as Niti just mentioned, is that you have to get the model right. Just to provide consulting from a shop does not get you enough revenues to meet your expenses. That's the bottom line. So what we are seeing is the emergence of models which will combine consulting with certain other facilities. Now what those should be, what will bring in more revenues and more to the bottom line is something that depends on the entrepreneur's study of the area. So people are adding pharmacy counter to the clinic, and they're adding certain value-added services, getting corporate clients into the game, which gives fixed stream of revenues, predictable stream of revenues, so on and so forth. So those are the things one needs to experiment with. And that is what will take time and needs a longer horizon, the ability for the entrepreneur to sustain during that period and for the investor as well.
Okay, we have time for one last question. Here, please.
Hi, I'm Dinesh Verma. I'm an ophthalmologist getting into the space of medical devices. My question is to Gaurav. You mentioned that medical devices market or low-cost devices in India is sort of not picking up because of the lack of innovation and R&D, and also because you have second-hand equipment available. I think there's a big aspect which has not been looked at, is that all the big players, from the clinical point of view, they are so much influenced by the big corporates who produce the medical equipments. I recently attended one of the largest ophthalmology conferences in Hyderabad. It's the second largest in the world. And almost every opinion maker in ophthalmology was put up in a nice 5-star hotel by the equipment manufacturer company. And when I talk about my device, which could be 50,000 rupees, while the others are selling for 50 lakh rupees, they just look at it and say, oh, how can you produce that? It's ridiculous. And no, they're not even willing to do clinical trials for such a thing. For other devices which have been in the market, there are innovators in the market. Ophthalmology, the other example is laser phaco.
So you're talking about how to establish credibility.
Exactly,
I guess, right?
and you know, there must be some, to cross that barrier, there must be some other way for Indian entrepreneurs to get into this
Can
space.
help us?
Actually, my point was that, and it's great to see companies like you doing this. But my point was that the reason entrepreneurship is not, and people like you are finding it tough, is because there's a lot of sort of dumping going on in the market by the larger guys, and also other practices that you referred to. And so unless if you're investing into R&D, you're building a new product, you need to be able to make money on that. You need to have a viable scale on that, both in terms of volume and kind of customers you get. And that has been a struggle because at least we've seen whatever little we've seen of the market. It seems like there's just a lot of supply, not necessarily very high quality, which is driven by a lot of other factors, and it's sort of stifling innovation. So I mean, I don't disagree with you. I think what you're saying, I think it's just finding the reference customers. I think finding the first 5 reference customers, people who are sort of thought leaders in the sector, in the industry, which is not always easy given some of the practices you refer to.
Thanks, sir. So I guess we'll wrap up the session here. The panel is here for most of the day. If you have any questions, you can ask them. Thank you so much, gentlemen.